So I found 4 entry-level remote healthcare jobs. So if you're looking to get a start in the healthcare field, these jobs might work out for you. Some of these positions are non-phone, and you can earn anywhere from about $18 to over $28 per hour, depending on the job you take. So we're going to jump right into them, starting with the company Savista. And they consider themselves to providing trusted revenue cycle management services. So in other words, they basically do the billing and accounts receivable for healthcare facilities. Right now they're looking for a financial clearance specialist, and this is a full-time remote position. You can do this job anywhere within the United States. And I'm just going to scroll down here to see if they tell us how much they pay, and I don't see it on this job lead. But based on my experience looking at jobs like this, I'm thinking you can make anywhere from about $20, maybe up to $25 per hour. But there's no way I can guarantee that's how much you'll make. You'll have to work that out with them. So in this job, you will be on the phone. You'll contact insurance companies, physicians, and patients to ensure that accurate patient demographics and insurance information is collected and that a financial clearance determination can be made. You'll also inform patients on their rights and collect patient liabilities. And you'll do that while providing excellent customer service to all parties by responding to customer requests. And when they're referring to customers, they mean patients, doctors, healthcare facilities, as well as other people within the Savista company. So on a regular basis, you'll verify eligibility and benefits using electronic and telephonic resources. So in other words, you'll be gathering information by making phone calls and using online resources. You'll obtain pre-certifications, authorizations, and referrals to ensure managed care compliance for necessary appointments and fulfill notification requirements for inpatient admits. You'll contact patients to request and obtain monies due, including monies due from previous visits, as well as issue receipts. You'll establish payment plans for patients unable to pay monies due in full and enter the information gathered into the computer system. So you'll be doing a whole bunch of data entry in this position as well. So that's what you're going to be doing on a regular basis. On occasion, you might work closely with various departments throughout the health system. You may also identify and communicate insurance plan updates to CMS billing managers for input into the insurance master and provide patient education concerning patients' rights, regulatory requirements, and financial policies. You may even exchange necessary information with the physician offices, hospitals, nursing homes, and other departments, and prepare oral and written communication, including periodic status reports. You might answer indirect telephone calls and document notes in the computer system regarding all conversations with patients, insurance company representatives, pre-certification notification representatives, and results of collection efforts. So to qualify for this position, they'd like you to have a high school diploma or equivalent. Some college courses is preferred, and that's just preferred. That's not required. They'd like you to have 1 year of service-related experience, but they don't say in a healthcare setting. So if you've ever had a job similar to this, I think you qualify. And they prefer you have 3 years of service-related experience, and that's just preferred. They also prefer you have 1 to 2 years experience in registering and billing in a medical setting or insurance claims, and that's preferred. And they prefer you have some medical terminology or insurance terminology, and that's just preferred. If you want to learn some medical terminology, I'll put a link to a really good resource in the description below this video. So you need strong interpersonal skills, and you're able to handle, diffuse, and resolve difficult situations, including customer complaints. You're adaptable, highly motivated, you have analytical skills, you're organized, and you're able to handle multiple tasks. So if you like this job, you can find the direct link in the description below this video. This is job number 1. The second entry-level remote healthcare job I have is with Prime Therapeutics. They're a pharmacy benefits management company. And the remote job they have available right now is for a senior enrollment specialist. This is a full-time remote position. You can do this job from home anywhere within the United States. And I'm just going to scroll on down here to see if they tell us how much they pay, which they do. It's between $18.87 and $28.30 per hour. So in this position, you'll be responsible for doing the data entry and file maintenance of enrollment, assessment, and disenrollment documentation for strategic business unit operations. So that means you'll do a whole bunch of data entry accurately and timely. You'll communicate with appropriate contacts on eligibility issues and questions, and answer incoming calls on eligibility, program benefits, plan limitations, and point-of-sale edits from providers. You'll also assist in data collection and reporting and complete bi-weekly check rate production for provider payments in the accounts payable system. You'll assist with quality monitoring and provide constructive feedback, and review production reports, identify issues, and recommend resolutions. So they're looking for someone who's a team player. You're flexible, organized, and you're able to manage multiple tasks. You have strong verbal and written communication skills. You take the initiative, you're resourceful, and you have great sense of integrity. and you're able to interact with internal and external clients with confidence. And of course, you need to be comfortable using a computer. You have a working knowledge of Microsoft Office Suite. You're able and willing to learn other proprietary computer systems quickly and efficiently. And they don't require, but they prefer you have experience in healthcare, managed care, or pharmacy management. And they list a few other preferences. They'd like you to have customer service experience, and they don't tell us in what capacity or for how many years. So, like I always say, if you ever dealt with the public in any capacity, that qualifies as customer service. They prefer you have related work experience, that's just preferred, and they prefer you have a bachelor's degree, and that's just preferred. And they also prefer you have certifications, again, just preferred. So remember, this job pays between $18.87 and $28.30 per hour. If you like this one, you can find the link in the description below this video. This is job number 2. Okay, so I have 2 more jobs I'm going to share with you, but I want to quickly remind you to please subscribe to this channel, hit that notification bell, and make sure to turn on all notifications. That way you get all the job leads when I post them. That brings us to our 3rd entry-level healthcare job, and this one comes to us from SCA Health. So they consider themselves the leading experts in specialty care. So SCA Health is part of the larger Optum healthcare company. And right now they're looking for an associate insurance verification representative. This is a full-time remote position. You can do this job remotely anywhere within the United States, and they're going to pay at a minimum $20 per hour, at a maximum $22 per hour. And you'll be working Monday through Friday from 8:30 a.m. to 5 p.m. Eastern time zone, and you don't have to live in that time zone, just translate your local hours to those hours. So in this job, you will be doing a little bit of phone work. You'll verify that sufficient information is available for accurate verification and eligibility. So this step may require direct contact with physician offices and or patients. You determine if a secondary insurance should be added to the patient account, ensuring the appropriate payer is selected for primary insurance, and utilize various claims and eligibility systems as well as individual payer websites to obtain eligibility, benefits, and or pre-certifications and authorization information. You'll enter the patient insurance information into the patient accounting system, and when the patient's insurance is out of network, you'll notify your manager immediately, following policies and procedures when accepting out-of-network payers. So your main goal is to make sure each patient's insurance verification is complete and accurate, and you'll contact the patient with either estimated coinsurance, copay, and or deductible amounts due on or before the date of service. So you'll also be doing a lot of insurance authorization, just making sure everything is accurate, everything is entered into the system correctly. You'll check insurance companies' approved procedure list and medical policies, and if an insurance company is not going to pay for a procedure, you'll notify the patient. So if the patient wants to proceed, you'll obtain signature on Medicare ABN or other non-covered notification forms. You'll also calculate copay and estimated coinsurance due from patients, and contact the patient and communicate the center's financial policy. So you need to be familiar with individual payer guidelines, and you have a knowledge of payer contracts, including Medicare, Medicaid, and other government contracts. To qualify for this job, they're just looking for a high school diploma or a GED. You need strong customer service experience, and they prefer you have accounts receivable, billing, or insurance verification experience, and that's just preferred, that's not required. However, they do tell us healthcare experience is a must, but they don't tell us how much or what capacity. So if this job interests you, but you don't have healthcare experience, but you are interested in the healthcare field, definitely still apply for this job. And remember, they'll pay between $20 and $22 per hour. If you like this one, you can find the direct link below. This is job number 3. So our 4th and final entry-level healthcare job is also with Civista, and this is for a cash remittance patient accounts receivable representative. This is a full-time remote position. You can do this job anywhere within the United States, but unfortunately they don't tell us how much they're going to pay in this position. But based on my experience, I'm willing to bet you can earn anywhere from about $18 to maybe $20, $23 per hour. How much you're really going to make, you're going to have to work that out with them. So in this position, you'll perform a variety of basic to moderately complex tasks related to the correspondence batching process, which includes posting payments, adjustments, and transfers to the billing and collection system. So in other words, you'll maintain and oversee the correspondence process, including pulling and posting batches to Epic, reviewing documentation for remittance denial codes, and posting $0 payments. You'll print daily lockbox images and bank statements, and review insurance explanation of benefits and post payments to the host system. You'll post payments and ensure allowances, adjustments, and write-offs are posted correctly, post denial reasons and forward to the appropriate representative for further review, process zero pay explanation of benefits and post appropriate reasons for zero pay, and verify electronic remittances are posted accurately. You'll also process and post credit card payments, investigate unidentified cash, and resolve misdirected payments, and you do all that while maintaining customer service level standards. And something I want to mention is down here they tell us they want you to be able to attend client meetings to present and discuss trends on a routine basis. Now, they never tell us you're going to do any kind of travel in this position, so if you're interested in knowing more about this, just make sure to ask them when you're interviewing. So to qualify for this job, they'd like you to have at least 2 years' experience in healthcare customer service or insurance collections field. You need a strong knowledge of explanation of benefits and payer financial classes, as well as strong knowledge of computer billing systems, including Epic and OnBase. You're able to work individually as well as in a team environment. You're able to work in a professional corporate setting. You have experience working with customer support, client issue resolution management, and you have excellent oral and written communication skills. So if you like this one, this is job number 4. You can find the direct link below. Well, there you go. We just went over 4 entry-level healthcare jobs to get started in the healthcare field. But if you're looking for something a little different, maybe you want to do medical billing, check out this video right here. Good luck to all of you who apply, and as always, thank you so much for visiting, and I'll meet you on the next job lead.